So how Nucleus, a quality improvement services provider, contributes to the UNICEF project?
So I think Nucleus, I will first say that, excuse me, I have a little bit of cold, but Nucleus is a quality assurance organization in Norway. We have 3,500 participants in general practice, primary healthcare, nursing homes, etc. And we are evaluating instruments on a routine basis for the Scandinavian market, together with our colleagues in Denmark and Sweden. So we are using this form of evaluation also for this project, where we evaluate the new instruments in real life. So we will place it out in emergency departments, in primary healthcare, etc. And then we will take consecutive patients and analyze samples from there to these new devices. So I think it will be, I think that this is the only real life experience that we will have with the device. So I look forward to that.
Okay. So which is your strategy for the pre-market performance evaluation regarding the devices developed during UNICEF?
So we will invite, or actually we will take people who feel that they have a respiratory disease. They will come to the either emergency departments or general practice, and they will take samples as they usually will do. So they will take double samples. They will take some samples that they routinely use and will send to a laboratory, and then they will take a parallel sample and analyze on these devices. And then we will compare the results to see sensitivity and specificity and actually the accuracy of these devices.
Mm-hmm. So how you will provide information for the diagnostic performance and the instrument user friendliness to the intended users?
Yeah, so we will ask the people who are using the instruments how they feel about the instruments. Is it easy to use? Is it difficult to use? And do they have any complaints, or do they have any ideas for improvement? And we will register this, and we will also submit this together with the analytical performance to the regulatory bodies. And then, of course, we will provide this information when we are going to use this instrument in real life or in the future when it's CE certified, then we will use this information to the end users.
Mm-hmm. And these studies, you will perform them among lay people?
Yes, we will, because in the previous pandemic, actually lay people was educated to use instruments for COVID. And we are actually going to educate lay people. We're not using it for self-measurement. I would just underline that. It's not for self-measurement. So we are educating people to learn how to use the instrument so that they actually can take samples from sick people and analyze them. So we will have I think it's about 25 or 40 lay people. We will introduce them to the instrument, we will educate them, and then we will see how well they perform the analytical part of the analysis.
I see. And since you have gained experience from the COVID-19 pandemic, can you please comment on some challenges faced previously and how you will implement this experience into the UNICEF project?
I think the experience we had from the COVID, because we evaluated a lot of COVID antigen and antibody tests, so the experience we have is actually that it's so important to use them in a real life situation. And as I said to previous question that you had, that I think this is the only place where we actually examined sample patients directly and analyzed directly on these new devices. And that's one of our experiences, that the analytical quality will be different when you take consecutive people and analyze it compared to when you take only laboratory samples. So this is one of the most important experience we have got. And also the experience that we, during COVID, had to educate people, lay people, how to learn and use the instrument is important. So in that connection, we made actually e-learning courses, etc., and of course in-person education. And this is some of the experience we will bring along us in this new European Union project.
Thank you.
Thank you for asking.